Masks are here to stay in California as evidence mounts that you may need to improve the type of mask you wear indoors.
In the past, 2 weeks or so, I've been wearing them since the cases have been going up, and I just want to make sure I'm safe.
Health officials say cloth masks are not enough to fight off the Omicron variant. Good evening, everyone. I'm Julie Hayner.
And I'm Alex Savage. The state's indoor mask mandate was set to expire on January 15th, but California's top health official announced today the requirement has been extended by at least 1 month to February 15th, and that's because of the current surge in COVID cases. Dr. Mark Galley said the state would reevaluate the numbers on that date, but did not provide criteria that would trigger an end to the mask mandate.
At that time, we will again reevaluate the conditions across California, our communities, and our healthcare delivery settings to make sure that we are taking the latest information into account to determine when, if there would be another extension.
With the rise in cases right now, doctors say it may be time to upgrade your mask. KTVU's Zach Sauce has been speaking with healthcare experts and joins us live tonight with more on what they're advising when it comes to masks. Zach?
Yeah, Alex, they say it really comes down to what type of mask you're wearing. If it's just a single cloth mask or even just a single surgical mask, they say that's likely not enough to stop the more contagious Omicron variant.
It's going to be hard to block transmission altogether. It just is, because Omicron is so transmissible.
And throughout the pandemic, infectious disease experts making it clear not all masks are created equal, particularly when faced with the Omicron variant.
If you really want no exposure at all, I would, if you're in the store, I would absolutely do the N95.
Other just as effective options, the
KN95, KF94, FFP2, or a surgical plus cloth mask.
The new guidance prompting the West Contra Costa Unified School District to mandate that teachers wear KN95 masks starting January 10th. Superintendent Kenneth Chris Hurst saying in a statement, quote, "The safety of our students and staff is our top priority, and we believe this is another important preventative measure we must take at this time." A sign of just how contagious the new variant is. Despite masking up, getting vaccinated, and taking other safety measures, Janice Holv says her
East Coast Christmas turned into COVID Christmas.
She's now stocked up with N95s and a multi-layer surgical mask she says is popular in Europe. Her experience with Omicron akin to a bad cold or flu, but
It's not something one wants to go through, even though, thank goodness for the vaccines.
if you don't have a multi-layer surgical mask, another option?
Doubling these or even putting this with a cloth, but this being on the outside.
Keeping the surgical mask on the outside, key.
Because it's made out of polypropylene material, which is negatively charged. So it actually repels the virus physically.
Others opting for the increasingly popular KF94s.
In the past, 2 weeks or so, I've been wearing them since the cases have been going up, and I just want to make sure I'm safe.
KF94 also one of the few masks in the 94-95 class that Dr. Gandhi says kids seem to find comfortable. Otherwise, a surgical mask will do, because she says the most important thing is that they keep them on.
Right now in schools, I would recommend that children still wear comfortable masks, which is what the state is recommending because they're children.
And as for a light at the end of the tunnel when it comes to Omicron, Dr. Gandhi says models suggest that it could peak by mid-January and then come down, so we may be through the worst of it by the end of January, early February. Live in Oakland, Zach Sauce, KTVU, Fox 2 News.
Okay, Zach, thank you.